Lannis. I'll be your nurse today. Could you go ahead and tell me your name and date of birth?
My name is Nathan Lannis, and my date of birth is June 28th, 1990.
Okay. I'm going to go ahead and close this curtain to give you some privacy.
Okay.
I'm going to raise the bed to a working height, and I'm going to perform some hand hygiene.
Okay.
So if you could go ahead and tell me the year.
2020.
Okay, and could you tell me who's president?
The current president is Donald Trump.
Okay, and could you go ahead and tell me where you are right now?
I'm in the hospital.
Okay, do you know why you're here, or what brought you in today?
I've been feeling some intense chest pain recently, so I wanted to come in and get it checked out.
Okay, let me grab my notes and I can get some subjective data from you.
Okay.
So, your chest pain, are you experiencing any dyspnea or shortness of breath?
No, I don't think so.
No. Are you experiencing any orthopnea or shortness of breath when you're lying down?
No, everything seems pretty normal with that.
Okay.
No.
Are you experiencing any coughing, edema, any fatigue or nocturia?
I've been feeling a little fatigued recently.
A little fatigued?
Yeah, that's all.
Okay.
Yeah.
Now I'm going to ask you some questions about your past medical history.
Okay.
So any past medical history of diabetes mellitus, hypertension, high cholesterol, anything like that?
I've had hypertension for about 2 years.
Okay. Now I'm going to ask you about your family medical history.
Okay.
So hypertension, obesity, coronary artery disease, any family history like that?
I have a family history of obesity, and both of my parents have hypertension.
Okay. Alright, do you smoke any cigarettes or cigars?
I smoke about a pack of cigarettes every week.
Okay.
Yeah.
Do you use any alcohol or drink any alcohol?
I probably have like 1 to 2 drinks per week.
Okay.
Yeah.
Alright, do you have any allergies?
I'm only allergic to pollen.
Pollen?
Yeah.
Are you on any medications right now?
Not right now.
No. Alright, have you noticed any leg pain, leg cramping?
No.
No?
Nothing abnormal.
Okay. And have you noticed any skin changes, whether in temperature, color, hair growth?
No.
No?
No.
Okay. And have you noticed any swelling in your arms or legs?
No.
No. Okay. So you were brought in today by your chest pain.
Mm-hmm.
Could you go ahead and tell me some characteristics of that pain? How does it feel?
I would say it's somewhat dull, and it's kind of an aching pain.
Okay, so when was the onset of that pain? When did it start?
It started about last night when I was on my drive home from work.
Okay, and where exactly is that pain located?
I would say it's about in the center of my chest, around where the heart is.
Okay, and what was the duration of that pain? How long has that been there?
So it started last night, and it woke me up a couple of times in the middle of the night.
Okay.
And I definitely felt it this morning, so it's probably been from last night up until now.
Okay.
Yeah.
On a scale of 1 to 10, 1 being the least amount of pain and 10 being the most amount of pain,
Okay.
How would you rate that pain in your chest?
I would say it's about a 5. It's very hard to ignore, and it's pretty constant.
Okay.
Yeah.
Have you noticed any patterns that, maybe ease the pain a little bit for you?
When I'm hunched over or sitting down, it helps a little bit. It kind of goes away for a short time, and then it comes back eventually.
Okay. And do you know of any associated factors that might have caused this chest pain?
While I was working on my shift last night, I ate a really big meal at Burger King, and so I've had some indigestion from that meal, and it's the pain's kind of been there ever since.
Okay.
Yeah.
So next what I would do is assess your vitals. So I would take your pulse and assess its rate and rhythm, and then I would assess your respiratory rate for about a minute to see how many breaths per minute you're taking, and then I would do your blood pressure.
Okay.
So what I'm going to do next is assess your hair and your scalp. I'm just looking for any lesions or any masses on the scalp, but I don't see any. I'm assessing the brittleness of the hair, but it's pretty soft and smooth. And what I'm going to do next is assess your eyes, do an ocular assessment.
Okay.
So if you could follow my pen with your eyes, perfect. And then I'm going to do some accommodation with your pupils, some dilation, accommodation. Okay, and now I'm going to assess the 6 cardinal fields of gaze. So follow my pen. Perfect. So what I notice is that your pupils are equal in size, they're round, and they are reactive to accommodation and light. They have good extraocular movement, and your pupils are about 4 millimeters.
Okay.
Or actually, so now I'm going to assess your nose. So if you could block one nostril for me and breathe in and out. Perfect. And then with the other. Okay, so I noticed that your nares are patent and your airway is clear and free of any obstruction.
Okay.
So now I'm going to assess your mouth. I noticed that your lips are symmetrical and there's no lesions or cracks on them. So in the mouth, gingiva is pink and moist. No inflammation or gingivitis, no erythema, no cyanosis. Teeth are white, they're all there. No teeth are missing. Your tongue is moving normally, no fungus. It's pink, it's moist. It's a good shape and size. If you could go ahead and say ah. All right, I noticed that the soft palate and the uvula are rising when he makes speech noises. Everything looks good there. So now I'm going to assess your facial muscles. I noticed that your face is symmetrical. Your features are symmetrical. I don't see any lesions on either side or anything lopsided like that.
Okay.
So if you could go ahead and puff out your cheeks. Perfect. And then stick out your tongue and move it side to side. All right, and then raise your eyebrows up and down. All right, perfect. Now I'm going to do a skin assessment. So I'm going to feel the temperature of your skin with the backs of my hands. Okay, you're pretty warm, but that's normal. Again, warm on the legs as well. Now I'm going to inspect your skin just to feel for any moisture. So your skin's a little moist, probably from some diaphoresis, some sweating. That's normal as well. And as well on the legs, a little bit of moisture from diaphoresis. And now I'm going to assess the color of your skin. So it's tan, has an olive undertone. I don't see any erythema, don't see any cyanosis.
Okay.
No, I don't see any lesions or anything like that. No masses. And then on your legs, tan, olive undertone. Don't see any lesions, don't see any masses. No erythema or cyanosis on the legs. I'm going to feel for some edema. So don't feel any edema on your legs. I'm going to feel for some edema on your arms. Don't feel any edema on your arms. So next what I'm going to do is assess your nails.
Okay.
So your nails are even, they're smooth, the nail beds are even, they're trimmed, there's no clubbing, 160-degree angle on your nails. They look good. I'm going to do a capillary refill assessment. Alright, less than 2 seconds. And again, less than 2 seconds. Toenails also smooth, no erythema or swelling or anything like that, no inflammation, capillary refill, less than 2 seconds. And again, less than 2 seconds. Again, also 160-degree angle, no clubbing. And now I'm going to do an assessment on your neck. So I'm just going to feel for any nodules or papules on your neck. I don't feel any abnormal masses or anything like that, so I'm going to go ahead and assess your carotid artery. Alright, normal rate and rhythm. going to auscultate your carotid artery just to listen for any bruits or anything like that. Alright, don't hear any bruits. Alright, no bruits there either. Now I'm going to assess your heart. So I'm going to check your pulses, and we're going to start with your radial pulse. Alright, normal rate and rhythm, about 2 plus amplitude. And on the left, to assess bilaterally, normal rate and rhythm, also 2 plus amplitude. I'm going to assess the dorsalis pedis. Alright, normal rate and rhythm, probably about a 1 amplitude there. And then on the other foot, normal rate and rhythm again, also a 1. Now I'm going to assess the posterior tibialis pulse. Alright, normal rate and rhythm, probably about a 1 amplitude, 1 plus. And then on the left, alright, another normal rate and rhythm, again probably about a 1 plus amplitude.
Okay.
So now I'm going to do a cardiac assessment, if you don't mind standing up for me.
Okay.
Alright, so to start with a cardiac assessment, we're going to feel on the sternum for a distinct bony ridge, which is about right there. And then we're going to go to the left and right sternal border to assess the aortic and the pulmonic. Alright, so I assessed the aortic, didn't hear any abnormal sounds there. Now I'm going to assess the pulmonic. Alright, no abnormal sounds there either. So at the aortic and the pulmonic, what we can hear the most distinguished is the S2 heart sound, which is the dub sound. So now I'm going to go down to the third intercostal space, the left sternal border, and we're going to assess Erb's point. Alright, no abnormal heart sounds there. We can hear S1 and S2 there. And then I'm going to go to the fourth intercostal space to assess the tricuspid. Alright, no abnormal heart sounds there either. What we can hear there is the S1 heart sound, the most distinguished. And for the mitral pulse, we're going to go down to the fifth intercostal space, about 7 centimeters to the left, and we're going to assess that pulse for a minute. Alright, so normal rate and rhythm at your mitral pulse. Didn't hear any abnormal heart sounds or anything like that. So now we're going to continue on with the lung assessment. So for the lungs, you're going to for the posterior lung assessment, you want to start at the carotid or the clavicle and listen there, and then work your way down the chest. So I'm going to go ahead and do that. Okay, and now we're going to do posterior lung assessment. So for the posterior lung assessment, you want to start at C7 and then work your way around the scapula. Okay, no adventitious lung sounds at all, no rhonchi, no wheezing, no crackles or anything. So we're going to assess laterally as well for the lungs. Again, no adventitious lung sounds were heard upon assessment. All right, now I'm going to assess your abdomen if you'd like to lay down for me. All right, and if you can lift up your shirt. All right, so the abdomen is flat. There's no distension in the abdomen. There's no erythema. There's no cyanosis. Looks normal to me. No visible masses or anything like that. So I'm going to go ahead and auscultate. And I'm going to listen for some active bowel sounds. I'm going to start in the right lower quadrant. Okay, then the right upper quadrant. All right, the left upper quadrant. And the left lower quadrant. All right, so I heard 5 different bowel sounds, which means that you have a good digestive tract and active GI tract. Now I'm going to palpate your abdomen and just tell me if there's any tenderness. Any tenderness in the right lower quadrant?
No.
Okay. Tenderness in the right upper quadrant?
No.
No. Right or left upper quadrant? Any tenderness there?
Still nothing.
Okay. And the left lower quadrant? Any tenderness?
No.
Okay. Now I'm going to do a range of motion assessment. So if you could abduct and adduct your arms. Perfect, and flex and extend your arms. All right, and if you could flex and extend your feet, your legs. Okay, and if you could touch your left heel to your right knee. Okay, and then your right heel to your left knee. Perfect. Now we're going to assess your balance and gait. So if you could just take a walk back and forth for me. All right, normal, steady gait, no leaning to one side, no limping or anything. And now if you could do a tandem walk, which is heel to toe, to assess your balance. All right, good, steady balance. All right, you're coordinated and balanced. And that's all I have to do for your assessment. So you can go ahead and lie down for me. Okay. And here's a pillow if you need it. And I brought you a blanket for your comfort. Do you need anything else from me? Anything to help you feel more comfortable?
No.
Okay. I'm going to lower the bed.
Okay.
And I'm going to put your call light right within reach if you need it. If you need me at all, use the call light. Okay. And I'll come right away. I'm going to do some hand hygiene. I'm going to open back up your curtain. And again, if you need me, you can use the call light. I'll be right down the hall.
Okay.
All right.